If you're a retiree or soon to be retiree, avoiding costly Medicare mistakes is crucial, especially when it comes to making sure your healthcare is covered without draining your savings. Medicare can be confusing, and one wrong move could end up costing you more in the long run. That's exactly what we're going to break down today: how to avoid those costly mistakes and make sure you're getting the coverage you need. But before we dive in, if you're serious about protecting your wealth and want to make sure your financial future is secure, especially if you have 100K or more in your IRA or 401K, check out the first link in the description for a free gold IRA guide. Thousands of Americans are opening gold IRAs to diversify and safeguard their wealth. Now let's jump into Medicare. One of the first mistakes people make is enrolling too late. Many don't realize that if you don't sign up for Medicare when you first become eligible, usually around 65, you could face late enrollment penalties. This can affect both your premiums and your coverage, which means you could end up paying more than you need to for less than optimal coverage. The trick here? Mark your calendar and set reminders. Make sure you know when your initial enrollment period starts and don't miss it. Another costly mistake is not understanding the difference between Medicare Part A, Part B, Part C, and Part D. It's easy to get lost in the terminology, but knowing which parts of Medicare you need is crucial. Part A covers hospital stays, and Part B covers outpatient services like doctor visits. But while Part A is usually free, Part B can have a premium, and that premium increases if you don't sign up when you first qualify. Part C, known as Medicare Advantage, bundles everything together and may offer additional benefits like dental and vision coverage. But you have to understand what's included and make sure it fits your needs. Then there's Part D, which covers prescription drugs. And just like with Part B, if you don't enroll in Part D when you're first eligible, you could face penalties later on. The key takeaway here is that enrolling in the right parts when you're first eligible can save you from future headaches and higher costs. Now, some people believe they don't need prescription coverage because they don't take many medications. But the problem is, the moment you need those prescriptions, you may find that you're locked out of signing up for a plan and you'll have to pay more. If you're serious about protecting your wealth in the next 2 weeks, I highly encourage you to click the first link in the description and grab your free gold IRA guide. It's perfect for retirees looking to protect their savings with gold, especially if you're one of the thousands of Americans with 100K or more in an IRA or 401K. It's a step you can take right now to ensure your future is as secure as possible. Moving on to another major pitfall: relying too heavily on traditional Medicare. It's important to consider a supplemental plan, often called Medigap. Traditional Medicare doesn't cover everything, especially if you need frequent medical care, and that can lead to out-of-pocket costs that add up quickly. A Medigap plan can help fill in the gaps, but not all Medigap policies are the same. It's essential to compare different plans and make sure they meet your specific needs, so you don't find yourself paying more than you should for coverage you don't need. And here's a huge one: not factoring in your long-term healthcare needs. As we age, our health needs change. This is why it's important to plan for the future. Don't make the mistake of assuming that your healthcare will stay static. Look into long-term care options, as they can be incredibly costly if you need them down the road. Some people assume their Medicare coverage will take care of everything, but Medicare doesn't cover long-term care in most cases. If you need assistance with daily activities or skilled nursing care, you might need separate insurance, and you'll want to plan ahead for that. At this point, you might be wondering, how does all of this connect to protecting my wealth? Well, as a retiree, every decision you make about your healthcare, including Medicare, impacts your overall financial health. If you end up paying more than you need to for healthcare, that could reduce the amount you have available to preserve your wealth. This is exactly why I recommend diversifying your portfolio with a gold IRA, especially for those of you with over 100K or even $5 in savings. Gold has been a proven hedge against inflation and economic uncertainty, and it could be a key part of securing your financial future. So, to recap, avoid costly Medicare mistakes by enrolling on time, understanding your options, considering supplemental plans, and planning for long-term care needs. And don't forget, securing your wealth with a gold IRA can be an essential part of your strategy for financial security in retirement. Again, if you're ready to take control of your retirement wealth, click the link below to get your free gold IRA guide. For those of you with 100K or more in your IRA or 401K, or even up to $5 million in savings, don't wait to protect what you've worked hard for. Grab your free guide today and start securing your financial future.